Excuse me, folks. It seems like I'm coming down with a nasty cold or something. It's that time of year. Can you relate? Have you ever started to feel like you're getting sick and you immediately go to your medicine cabinet to see if you have any leftover antibiotics? As you rummage around in the cabinet, you might find a bottle or two with a few antibiotics left in them, left over from the last time that you were sick. You had saved them thinking you were feeling better and would keep them just in case you got sick again. I mean, what is the point? You would make an appointment to see the doctor, and who knows, might even get sicker from waiting in the waiting room. All for the doctor to give you the same pills you already have at home. I have studied the recommendations for antibiotic use, such as use, as well as attended the Oklahoma State Symposium on Antibiotic Overuse Resistance several times. Well, I'm here today to tell you that you are actually hurting yourself, those around you, and future generations. Their health actually depends on what you do next. According to the Centers for Disease Control, or the CDC, antibiotic resistance is one of the top concerns they have right now. Well, I'm here today to tell you that you are actually hurting yourself, those around you, and future generations. Their health actually depends on what you do next. Today, I will discuss correct antibiotic usage, resistance, and how you can help alleviate this problem. According to the FDA, antibiotic resistance is one of the most pressing public health issues facing the world today. If left unchecked, antibiotic resistance will cause 10 million human deaths per year, more than the number of people who currently die from cancer and diabetes combined. Significance. Correct antibiotic usage according to the Mayo Clinic. Antibiotics are important drugs. It would be difficult to overstate the benefit penicillin and other antibiotics have played in treating bacterial infections, preventing the spread of disease, and minimizing serious complications of disease. But there is also a problem with antibiotic medications. Drugs that used to be standard treatments for bacterial infections are now less effective or don't work at all. When an antibiotic drug no longer has an effect on a certain strain of bacteria, those bacteria are said to be an antibiotic resistant. The overuse and misuse of antibiotics are key factors contributing to antibiotic resistance. The general public, doctors, and hospitals all play a role in ensuring proper use of the drugs and minimizing the development of antibiotic resistance. What causes antibiotic resistance, you may ask? The Oklahoma State Health Department states, a bacterium is resistant to a drug when it has changed in some way that either protects it from the action of the drug or neutralizes the drug. Any bacterium that survives an antibiotic treatment can then multiply and pass on its resistance properties. Also, some bacteria can transfer their drug-resistant properties to other bacteria, as if passing along a cheat sheet to help others survive. The fact that bacteria develops resistance to a drug is normal and expected. However, the way that drugs are used affects how quickly and to what extent drug resistance occurs. Now I will discuss the overuse of antibiotics. In Makeley's book entitled Professionalism in Healthcare, the overuse of antibiotics, especially taking antibiotics even when they're not the appropriate treatment, promotes antibiotic resistance. If you take an antibiotic when you actually have a viral infection, the antibiotic is still attacking bacteria in your body, bacteria that are either beneficial or at least not causing disease. This misdirected treatment can then promote antibiotic-resistant properties and harmless bacteria that can be shared with other bacteria. Some of the symptoms include cold, the flu, bronchitis, sore throats, and some ear infections. Failure to take an antibiotic as prescribed can contribute to antibiotic resistance. The instructions for an antibiotic tell you how many pills to take and how often you should take them. The prescription is filled so that you have the exact number of drugs you need to take to complete the course of treatment. And here are the consequences of antibiotic resistance. In the United States, according to a 2013 report by the Centers for Disease Control and Prevention, at least 2 million people annually acquire serious infections with bacteria that are resistant to one or more of the antibiotics designed to treat those infections. And at least 23,000 people die annually from antibiotic-resistant infections. Antibiotic stewardship, according to the American Journal of Nursing. Antibiotics can be lifesavers, but misuse has increased the number of drug-resistant germs. Here are some tips to help prevent. Practice good hygiene. Wash your hands regularly with soap and water, especially after using the toilet, before eating, before preparing food, and after handling fresh meat. As you can see, you are actually hurting yourself, those around you, and future generations. Their health actually depends on what you need to do next. Antibiotic resistance is one of the most pressing public health issues facing the world today. If left unchecked, antibiotic resistance will cause 10 million human deaths per year, more than the number of people who currently die from cancer and diabetes combined. Antibiotic resistance is a growing public health concern worldwide. When a person is infected with an antibiotic-resistant bacterium, not only is treatment of that patient more difficult, but the antibiotic-resistant bacterium may spread to other people. When antibiotics don't work, the result can be longer illnesses, more doctor visits, and ultimately, more deaths caused by infections. So the next time if you're thinking about catching a simple cold, I urge you to think twice before going to your medicine cabinet and taking those old pills. Do your part, and together we can make a difference in the world of infection.